Hello, everybody. This is Joseph Alpert, editor-in-chief of the American Journal of Medicine. I'm here to call your attention to what I thought was an interesting article. It's by Jain, Jain et al. He's at Emory, and the other authors are from a variety of different institutions. And it has to do with the demographics of diabetes, hypertension, hyperlipidemia throughout the United States over recent years compared with earlier years. I think, as many of you know, and the American Heart Association is always very proud to tell us, mortality from both stroke and heart attack has been decreasing for 50 years. Very nice downward sweep. But everybody, the epidemiologists and the doctors and the nurses, we've all been worried, that these good public health statistics are going to turn around as the incidence of diabetes in the country is rising and rising and rising, because we know diabetes is a huge risk for atherosclerotic, ischemic heart disease and stroke. So what these folks did was they looked at some of the recent numbers and mortality rates, and indeed, the fall has stopped and it's now starting to come up again. And we're sure, it's because of the increasing incidence of the risk factors for atherosclerosis. So what it says is we don't need newer products for people with ischemic disease. We need to really work on public health measures, get people to get themselves their weight down and watch what they're eating, diets that aren't crawling with sugar and so forth, and try and stem this tide of diabetes. It is just what people were worried about is starting to happen, that we're seeing a rise again in atherosclerotic heart disease. We'll just have to, do the usual public health things to try and get people in a healthier state. There was an interesting article also in an earlier issue that came out with Michael Rich from Washington University in St. Louis. And they pointed out the same thing, that there are areas of the U.S., particularly where there's poverty, where there's very high incidence of diabetes and hypertension, not, adequately prevented and not adequately treated. So we have big public health problems here in this U.S., and we need to, sort of roll up our sleeves and go after them. Well, in any case, no more editorializing. A pleasure talking with everybody, and please stay in touch with us in our various social media. I look forward to talking with you next month.